All right. Well, it looks like I think we're going to get going here. Hopefully, y'all can hear me. My name's David Lipsetz. I'm the CEO for the Housing Assistance Council. Um, Before we get going, I do want to give a big thank you to our friends at Rural Assembly and the Center for Rural Strategy. Mary, Sketch, Joel, Adam, Jan, Marty, Whitney, Dee, all you guys, you do phenomenal work, and we're thrilled to host the Housing Assistance Council. Thrilled to host this event for you. We also, I don't think, can start out what we're doing today without talking a bit about the demonstrations and raw emotion that's coursing through all of our small towns and big cities, as triggered by the Minneapolis police killing George Floyd. It's hardly news to point out to anybody that policing is not the only institution out there that has a history of hurting rural minority communities. We've had years of racist housing policies that have left a mark on all of us, and wittingly or not, our housing system has been channeling wealth to white families while contributing to the poverty and poor health of Black and brown families for decades and decades throughout our history. So taking a moment just to recognize that, understanding the context that we're going to talk today about COVID-19's impact on housing in rural communities, I think is about the least we can do. I know all of our organizations have been talking out loud about what we can do moving forward and how we can better recognize the challenges we're up against and the effort we got to make. So with that, with today's panel, fantastic group of friends that are here. We'll try to weave into that conversation some of what I just said there, so we can create a safe space where our panelists are going to get a chance to comment, and viewers and others, just to share out these feelings and make sure that all of us here recognize our commitment to getting more done on that front. Okay, so for those of you who don't know my organization, Housing Assistance Council, our friends call us HAC, and so do some other people, but we're the only national organization focused exclusively on housing in small towns in rural America. We've been around for 50 years and worked with thousands of local organizations across every rural region in the country. We provide training, we help them answer technical questions, we lend them some money at below market rates, so they can build up quality houses and apartments. Our goal in all of that is to help the local groups grow and thrive. You don't need to say it. Well, sure, I need to say it. Local groups know best, right? They know their community needs. So if we can walk in and help build some capacity and support them in what they're doing, they'll be able to do good things for years to come. And we're really proud of that history here. And with a headquarter in DC, to take what we learn on our work around the country and try to put it together with some high quality research. I feel like we're doing some work here to represent the needs of rural places and inform sound public policy here inside DC, but for people all around the country. All right, so if you're watching or listening today and think we can give you a hand at HAC, please check us out at ruralhome.org. And if you're also on and tweeting or on social media today, you can hit the hashtag rural conversations and rural housing. That would be fantastic. So let's introduce the topic at hand today. COVID-19 has put a pretty bright spotlight on the inequities that exist in our country, and frankly is making them worse. That's not news. Rural places, especially the poor rural places in which many of us are working and living, are suffering dearly. I was looking at data last night showing that 19 of the 20 top counties for infection rates per person are rural. And we can talk a little bit about why that is with our panelists. So you're going to get a chance to hear, I think, from a group of rural housing and health experts here today about the impact of this pandemic and what it's really done in the world of rural housing and how the housing providers that we work with are responding. Once again, hashtag rural conversations and rural housing if you want to get in on there on Twitter, and we'll have a survey after the event, that you can fill it out, and we'd appreciate your help there. Just it helps us get some feedback on what to work on. So with no further ado, thrilled to introduce Lance George, Director of HACS Research and Information. He's got some recent work that we've been doing to examine COVID's impact on rural communities. And take it away, Lance.
Thanks, David. And I'd like to echo David's sentiments and thanks to Rural Assembly. And really, I'm looking forward to today's discussion to hear from the participants and everyone on the call about what's happening in rural communities. I'm really looking forward to that discussion. We thought we might provide a little bit of context and give some overview of some larger issues, again, to provide some context for the larger and general discussion today. I don't think I'd be a researcher if I didn't put footnotes and endnotes and caveats. Many of you, your rural audience, you know that in rural communities, we struggle with data and information more so than other places. There's a lag, sometimes there's not information. And it's been really compounded, candidly, by some of the turbulence in economic reporting as of late. I think a good example was last Friday's unemployment figures, where almost every economist had estimated more than 20% or 20% unemployment, and the unemployment rate actually fell. So I think that's a good indication. I'm really, I often say I'm good at bad analogies. This is the proverbial 30,000 foot view, but there are a lot of clouds, I will say, kind of looking down, and a little bit of turbulence here and there. So not trying to undercut the argument, just letting you know and being honest with you, there are a lot of footnotes and endnotes, but we just kind of wanted to predicate some of the presentation. I do think we've done a good faith effort in trying to understand conditions over the long term and in the more immediate short term. I wanted to start out with looking at the genesis of the conversation today, which would be COVID-19. I know there's been a lot of reporting and a lot of really good reporting, especially from the Daily Yonder on this. We look to that as a source. So it's been really good, but at the same time, I do think it's obviously salient to today's discussion, and it is ephemeral, right? These numbers change on a daily basis. So just presenting that very quickly. As of last night, we ran the most recent numbers. The estimates are there were about 157,000 reported cases outside of metropolitan areas. And that is, I think reported is the operative word. We all think that's probably an undercount, but the graphic we're presenting there is just a quick histogram to show you new cases by day starting out from early February. And the trajectory and the projection has been a little different in rural communities. So each of those days is a new case, and I think it has manifested itself obviously different in rural communities. And the yellow lines are the reported associated deaths. So about 5,700 deaths and 153,000 reported cases as of June 7th. Just to give a quick, and it'll take a few seconds for the map to load here, but a quick geographic perspective of this. And it'll load here in just a second. These are relatively large maps. But this map is, the initial map is the reported COVID-19 cases as of March 16th. That's a really arbitrary date, but that's the day in which the CDC issued social distancing guidelines. And you'll note most of rural counties, these are outside metropolitan area counties, were gray, indicating there were no cases. And there are a spattering of yellow counties colored in yellow, where there were probably less than 20 reported cases. And if you just fast forward to the most recent data, the June 7th data, you'll see this. So I think there are two kind of quick observations here. The first is it's been widespread. It's impacted almost every rural community. And the second is, which I think, I'm not an epidemiologist, but I think has been the story of this issue in this virus, is that it has been very uneven in some instances, right? So the areas in orange indicate a much larger number of cases, and the areas in darker orange and red indicate more than 1,000 cases, candidly. So you see some communities, and if you go on HACS website, we have more detailed data on actual case rates that David was mentioning before, but you'll see there's been a larger impact in certain communities, notably the rural Southeast, and particularly African-American communities, some Midwestern counties that have very high rates that are often associated with meat production facilities, and some Native American communities in the West and lower Southwest. And all of those communities, kind of to point very quickly to David's statement, are disproportionately, these impact minority communities. So you'll see this kind of uneven trend within the data. And the very last slide is just to show maybe the difference in the trajectory. And again, I think this graph shows a couple of different things. The gray bars here are metropolitan reported cases, and the orange bars are outside metropolitan areas. And I think you can, again, not being a medical scientist, but there's somewhat of a decline in the metropolitan cases. But you'll see an increase as a share, even though it's relatively small, in rural communities. So over the last 30 days, the rate of cases have actually are nearly doubled. But at the same time, I think it's important to acknowledge that it's still at the most probably 8% of cases and about 4% of deaths. And that's a larger discussion, how this disease has really impacted, bifurcated out of certain communities. But just wanted to acknowledge some of those larger scale dynamics before we got into the larger discussion. So the last recession, I think the first order impacts of this are health and safety and security, right? That's the main thing. The second order impacts are this obviously ground the entire world economy to a halt, right? So you have major economic fallout. And then thirdly, hopefully we get into some of the potential housing ramifications. It's, I think, important to note that, or not important to note, I shouldn't acknowledge this, but housing was probably, if not the cause, at the center of the last recession. And now there's a different order of things, and it's just a side note. Yesterday we were officially, even though those don't know, I mean, it's obvious, but yesterday was official announcement that we are now in a recession from the group, the Economic Board of Advisors. We just really quickly wanted to look at this second order kind of leading into housing, because if you talk to economists, it's jobs, 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 and this could have a huge impact on housing conditions and provision. So this is just a typical line showing the last basically year of unemployment. Now, unemployment has always ticked slightly higher than the national rate in rural communities, and you see it was slightly advancing in March, but it jumped from 4.7% in rural communities to 13.7%. So these are new data. They were just released last Thursday, but you'll see that huge jump. And I just wanted to quickly again show another geographic illustration to show how that's playing out, because there are a lot of disparate markets and how this might impact your community. But you'll see this is the map for March. So it's somewhat consistent. We can look at the legend very quickly, and it's got the most counties are in the 4 to 5% unemployment rate. But if you switch to April, and the red counties are above 10%, there are very few of them. If you look at just 1 month's change, you'll see the kind of dramatic geographic display. And I just might show an example. Gives me an opportunity to think about home, but I am from Lewis County, Kentucky. Now, Lewis County always had a relatively high unemployment rate. In March, it was above 10%. And the legend showing just a little differently here. Sorry, there's the data. But then if you look at Lewis County in April, it jumped to 20%. So that's a good illustration of just this impact on communities. Now, I think this would be, we want to follow this trend. These are, again, the April data. They don't really reflect the May data that were just presented at the national level on Friday. But this is a leading indicator, especially for the housing markets. And I think the major implications are many unemployed households have been buoyed by very helpful and needed economic stimulus and unemployment benefits. To some respects, there's what we almost call a waterfall or a cliff. Those are slated to end in the next few months, and the implications for housing could be dramatic. So just want to give a few housing characteristics that we look at. These are just basic housing starts and completions and permits, and you'll notice As of February into April, you see a dramatic decline. Now, these are not for rural areas. This is for the national. This is the only data that you can get. But you can see the supply side has been impacted. The entire housing ecosystem has really been impacted. Where I think, and I'm going to harken back to, I just want to highlight one particular element with housing, is yet again to mention that this might be a very uneven, an uneven impact or an uneven event in how it impacts rural households, notably the difference between renters and owners. Rental rates are lower in rural areas, but there's, I think, a mountain of evidence that lower income households and renters have been more disproportionately impacted through economic job loss. They have less stability to start with. So you could see a much larger immediate impact on renters, especially if unemployment benefits go away and unemployment stays relatively high. That's one thing I think we're immediately concerned about. I think there are also longer term implications on home ownership. And I wanted to point to one specific factor that I think people don't often acknowledge within the rural housing market, in the rental market. Rental housing looks different in rural America than it does elsewhere. Notably, there are a large number of single family rentals as opposed to multifamily structures. And this is important for a couple of reasons. One, many of the protections that were put in place by states oftentimes were protections for renters who own more than 4 units, so there are probably less protections. And then secondly, those owners, talking about the entire housing ecosystem, the supply side, who own single family rentals or smaller developments, they probably are less likely to weather a loss of rents. So I think there's a huge, in the entire housing ecosystem, there could be major impacts here. So I wanted to highlight that specific smaller issue that we might want to look at in rural markets. And then finally, I just want to focus on something that's a longer term issue, and it's the biggest issue in the room, right? Regardless of whether we have a health pandemic or not, that housing affordability is by far the largest housing challenge in the nation, but in rural America as well. I think there's oftentimes a narrative that maybe it's substandard housing or it's another issue, but the ability to afford housing is by far the largest housing challenge in the United States, and will likely be exacerbated by the current condition that we're in. So some of the projections and some of the data that we presented before were very, short term, month to month change. We're taking a much longer look back here, back to 1980. So this map illustrates any county colored in a shade of orange or red had more than a quarter of its residents what we call housing cost burden. Now, I apologize, I'm guilty as charged, I'm a houser, and we often use our own vernacular and terminology. But in very general terms, when your housing cost burden, that means you pay more than a third of your monthly, or more than 30% of your monthly income towards housing costs. And that's, kind of a general measure of you're paying too much. So in 1980, these areas, more than a quarter of residents were housing cost burdened, and the darker the colors, the more housing cost burden. So if you fast forward to the most recent data, again, that's a longer term look, you see a dramatic, this has been the largest issue and the largest challenge, and will only kind of continue and exacerbate. So I think this is a very big issue that we also need to keep our eye on, regardless if we're in a major health pandemic or not. And then finally, I'm really looking forward to the discussion. I just wanted to note, and David noted this before as well, the Housing Assistance Council. You can find most of this information on our website, either at www.ruralhome.org or on our data platform called the Rural Data Port. So with that, I'll turn it over to the next speaker, but thank you very much, or turn it back over to David. But thank you very much. And if you have any questions, and I'm looking forward to the discussion. Thank you.
Lance, thanks. You are definitely one of my favorite exports from the great state of Kentucky. So we're going to get to our panel here. I do encourage folks to put stuff in the YouTube chat and questions and such. We can get to as much of that as we can. Joining us today is Myra Martinez, Deputy Director of Affordable Homes of South Texas. They've been helping thousands of families across the valley, the Rio Grande Valley, for a lot of years, and they're doing so by building and rehabbing houses, but so much more. Paula, Myra, give us a wave. Hey.
Hi.
Paula Gutierrez joins us from South Carolina office. Hey, Paula. The South Carolina Office of Rural Health. where she works doing cross-cutting collaborations, pulling together different sectors of who we work with to get good health outcomes for all South Carolinians. And last, but certainly not least, hey, Sarah, we have Sarah Grimes from the Housing Assistance Corporation in Hendersonville, North Carolina, not far from where I got married just a couple of years ago. And Housing Assistance Corp provides safe and affordable housing opportunities in and around the county, and helping North Carolina prosper and thrive. So with that, Myra, maybe we can start with you. If you could tell us a little bit more about your organization and the communities you work in.
Great. Can everyone hear me? Yes, great. We're testing out some new equipment, so I'm the guinea pig. So Affordable Homes of South Texas has been around for 43 years, well, going to be 44 at the end of this month, actually. And we started off as a rehab, mainly rehab organization, improving substandard living conditions in the city of McAllen. But soon the need was shown it was very evident that we needed to go beyond that and create affordable housing opportunities, and not just in the city of McAllen, but in the area, the Rio Grande Valley of where we are. And so we started a slow progression on that, and now we serve Hidalgo County and Starr counties. And we are a lender, construction, home buyer development, or rather HUD counseling agency, and a loan servicer as well. In a nutshell, that's quick.
That's a great nutshell. Can you tell us a little bit about how your community's been impacted by COVID?
Sure. So one thing you kind of have to know about, well, it's actually pretty self-evident in rural communities in general, is that things take a while to get to the towns. Things take a while to get to us. And so we usually lag about maybe a month or two behind the rest of the nation whenever there's some trend or some, in this case, a pandemic coming through. We saw it coming. We knew it was going to hit us. We braced for it. So we reacted quickly enough that the counties had very strict shelter-in-place orders right from the get-go. And so we didn't really experience the spikes initially as other cities did. However, now that the state is reopening and we're all going back to work, in fact, our organization is full staff, full work back at OSTI, you're starting to see the spikes, and you're starting to have double-digit positive confirmed cases in Hidalgo County. We knew that going in. We knew, everybody kind of expected it, that as people started to get back to work, try and get back to normal, businesses started to reopen, that there were going to be some peaks. People, I think one of the first things that people down here did was head to the beach for Mother's Day. And, it was on the news, and you saw the beaches just covered with people and no masks really. And about 2 weeks later, 2.5 weeks later, came our first big spike. And so, I think we're going to feel the effects of it now, but we're ready for it. It gave us time to, I think, to prepare, not just our services, but for the community to prepare that, get used to it. And so we're starting to, we're bracing for it now.
Myra, you guys do awesome work. I'm proud to be associated with all of you guys. We know your staff is leaning in a really hard time. And so thanks for all you're doing. Pass that back to your staff. We look forward to continuing to work with you. And we've got some more questions coming for you.
Okay.
Paula, tell us a bit about your organization, the communities in which you work.
Hello, everyone. Thank you for having the South Carolina Office of Rural Health join. We are a nonprofit, and if I'm not mistaken, we are one of 3 in the whole nation that is a nonprofit. Most are tied to the government, and we started off as an entity that focused on healthcare providers. And then as we looked into the community, we opened up a program centered around birth outcomes, and that is Family Solutions. And then we kept expanding into what is going to accurately capture the pulse of rural areas in South Carolina. And the Rural Health Action Plan was born, and the rural health strategist, in my role came about. And in my role, that's what we're doing. Our office, we've gone from healthcare, realized that there's a whole lot more to a person's health than the actual healthcare. And we're expanding. We are now in this new initiative, the Rural Forward South Carolina, and we're very excited to see what that develops into. Unfortunately, COVID-19 hindered exactly what Rural Forward South Carolina is going to look like, but it definitely is the celebration of the wonderful outcomes and services and life that rural South Carolina has to offer.
Yeah, so the work that your organization's done is leading edge. It's fantastic the way you guys, as a nonprofit that's taken on that statewide role that often a public agency does. You've been extraordinary at pulling organizations together. So you're talking to a lot of folks, we know that. What stood out about the way parts of your community have been responding to the pandemic?
I'd like to start with how our agency decided what we're going to do. And one of our biggest concerns was the PPE for our healthcare providers. As you know, a lot of rural health hospitals and healthcare centers have been closed over the years. In South Carolina, I believe since 2010, 5 have been closed. And a legitimate fear are there going to be healthcare facilities closed as a result of COVID-19? We're not going to allow that to happen, at least due to PPE or funding. And so we really kicked up our services and did our research on funding opportunities and also where we could access PPE. We had a partnership with Blue Cross Blue Shield, and we were able to access thousands of masks, and we distributed them to different healthcare providers in rural South Carolina. And through our different programs, responding as well. And we want to make sure the healthcare areas are open, and also telemedicine, broadband, making sure that our schools are able to have the same opportunities our urban schools in South Carolina have. There are many schools that have that parking lot, they drive up to it, they have the access and the food, and not all areas have that same story for being able to have that quick and easy access to internet, because transportation is an issue and all families are not at home, they're also working.
Thanks, Paula. All right, Sarah Grimes, so good to see you. Hope you're well. Tell us a little bit about your organization, communities you work in.
Yes, we started 32 years ago in Henderson County, North Carolina, in the mountains. I grew up here, so I'm very excited to still live in the place where I grew up. But we run 3 programs, well, 4. We have our first program was a multifamily project for agriculture, year-round agriculture, labor, and migrant worker housing. And then home repair was the next focus of ours. Started with a lot of different partners in the county, and then we grew into doing single family development. We're the longest running self-help group in North Carolina. We also run the new homes programs, and then we actively do home repair and single family in 3 counties. We do multifamily projects. We're working in 7 counties. Do a lot of partnerships with UAll HAC DC and USDA. So we're happy to be partners. We do kind of a lot of range, but we're always up for partnerships where we can be valuable.
And you are. It's fantastic what you do in that region. Lance's comment about how us housers can get a little esoteric sometimes. For anyone who's listening who's not deep in the housing world, Sarah, can you say what self-help housing is?
Yes, it's a USDA program. We have a TA grant, which basically helps us do housing counseling to prepare people to be homeowners. And then our construction staff works with them while they put their own sweat equity into their home to make it affordable. So we're proudest of this program. We actually run 2 different grants. We do one in Henderson County, and then another shared grant in 2 counties, Transylvania and Polk. So.
Yeah, it's a remarkable program. We've been involved with it for years as well. It just, you've got families coming together who are going to own these adjacent lots. They're putting in sweat equity, helping each other build these houses. It's really been a powerful program across the country. So Sarah, take us back a little bit to October of last year, before at least I was hearing much about coronavirus. I think many people. What were the challenges your organization was facing? I know a couple of things you're really good at, but what kinds of things were going great? What did the needs around your community look like?
Well, I have a finance background and I love economics, and so I was watching Married to a Banker also. So we've been watching strategy, and we saw that there were more issues coming, and that the coronavirus was really the X factor. So we started working with our board early on in the year, doing some preparations, and if this does come, what would that look like? So we were prepared. We had a plan. We knew as home repair, most of our clients do have health issues or are elderly. So we started preparing them early to say, we're going to start on the track, but we don't know what that's going to look like if we get to a situation where health would be compromised. Had our single family homeowners prepared for if we had to work at distances or whatever that would look like based on what the governor said. And then multifamily, our first, Henderson County especially is a big retiree population. A lot of the COVID outbreak has been in retirement homes. So we immediately partnered with local churches and other nonprofits and got food delivery to all of our seniors' sites so they wouldn't have to go out, or anyone who was health compromised. Our area has done a really good job of nonprofits and local governments and things coming together. So where we're seeing issues, we don't have an issue. We usually, our apartments have a pretty good reserve based on the tax credit properties that were done in the 90s. They had lower reserves. So we do have properties that we are on the watch because those are the most volatile as far as incomes go and ability to pay rents. We're noticing that, we're getting to the point where unemployments are going to start running out, and businesses that had PPP money, we're looking at possibly 34% of those businesses not reopening. So we're trying to come up with plans for debt relief with different foundations, rent relief, different things like that. So we're trying to get ahead of the next wave that we see coming September, October.
Yeah, thanks for putting a note on that. For most of the folks in the housing world, we really have talked about how unemployment insurance and payroll protection loans, as hopefully they convert to grants, have been a saving grace at this immediate hit. But we're all starting to see a climb in delinquencies and missed rent payments, and have a fear for the end of summer when those other sources are running dry, and landlords need to be able to get a resource to keep their buildings up. Folks need to be able to pay the rent to stay in them. And when you're working in the affordable housing world, the margins are pretty tight. So good for you, Sarah. Really appreciate the work you guys do down there. So it's going to be a little stilted, but I do want to take a quick turn back to some of what I was saying at the beginning. In the middle of a pandemic, we're all scrambling. Our organizations are scrambling, and yet now we're seeing this extraordinary outpouring of nationwide demonstrations in response to police violence. We know that as housing folks, we've got a long history in this field as well. I'm wondering what of any of the three of you you've seen your organizations do in response to just the events of the last week or two.
Well, as far as affordable homes in South Texas, we, again, our area is a little bit insulated or a little bit more removed from what you would experience in the bigger cities, just population wise. And we have seen protests down here, which has been great because it's definitely something that has impacted everyone across the nation. But it's good to know that in an area where we don't have a high Black population, that the support for Black Lives Matter and the support for just human rights in general for that population is supported down here, and we support it as well. And we've kept an eye on it just in terms of what additional support we can provide, and making sure that it's not something that we shy away from. But we have open dialogue with our employees as well, even though it may not be in our backyard per se. If we can change the mindset of some of our staff just by open dialogue, then we've done our part as well in righting the wrongs of the nation.
Mm-hmm. All right. Well, I tell you what, let's turn, Myra, back to a question. We've all transitioned that staff really quickly, where most of us are working remotely. Our partners and peers are doing the same. And I know our jobs have changed a bunch and our actions. What kind of changes are you seeing in the servicing of loans? And again, for non-housing folks, Myra's who you send your check to, and I know their practices. If you're a little late, they're a very gentle servicer. They'll call you and ask you how you're doing, but they do need to keep payments coming in on rents and mortgages, so that they can take that capital and get it back working again for building even more affordable homes. So what kind of impacts are you seeing in your servicing work?
Right. So initially, when we knew that it was inevitable that we'd have an impact on our mortgage payments, we basically decided, okay, we're going to offer a rollover program for those that are impacted by the COVID for April. And so we put a form out on our website and said, if you have problems with your mortgage payment for this month because of COVID, please download this form, fill it out, and then we will, trying to assist you as best we can. We were very flexible in what documentation. In fact, we were pretty much trying to verify to the best of our ability that they were impacted by COVID without making them jump through hoops, unnecessary hoops, and lots of red tape, because we are in a unique situation. There's stress already from losing jobs or reduction of hours. That on top of that, if you make them come in with all sorts of documents just to prove that they were impacted by COVID, it just leads them to some undue stress on top of that as well. So the first time, well, we did it for April, and we did it for May. And we service about a little over 2,300 in loans, 2,300 loans we service. And we had about 140 requests for assistance or payment rollovers. And we went ahead and decided last week that we would do it one more time for June. And we're still hovering around the 150, 175 in terms of impacted by COVID. But again, we are bracing for July, August, September. We do feel that the brunt of impact on the ability for someone to make the mortgage payment is coming. We thought, initially we thought maybe the front end of it would be the biggest hit, but we feel that July, August, September would be the one where we're going to see the highest request for assistance. And if we don't, great. We would love to be proven wrong, but we are bracing for those months in particular, in terms of people still being impacted by COVID, maybe not being able to pick back up their hours, their full hours, and maybe businesses not even being able to open back up. And so that's when I think that we'll have a better sense of the true impact of COVID long-term.
Got it. All right, thanks. And I mean, you could be on next week's panel as well, where we turn this same topic to the attention of what's the federal response been, and encouraging policymakers to recognize that housing is going to face a real cliff coming up here. And that's, I guess, a reminder, next Tuesday at 2:00, we're right back, same bat channel here to have some more conversation. We'll turn our attention to what has been the public policy response. So I'm seeing some questions come into the YouTube chat, and want to turn to those. I know we have a couple more topics that we've thought about as a panel, but Paula, can you tell us, does every state have an Office of Rural Health? And what specifically differentiates that, and what exactly do y'all do?
I believe every Office of Rural Health differs in some way. What sets us aside is what I mentioned earlier. We're one of 3 nationally that is a nonprofit. We've been in existence since 1991, taking a look at rural health, healthcare specific, and expanding it to community service and also investment. We have a fantastic program that's Blueprint for Health, among many others. And that is really, we want to avoid prescribing what a community needs, but rather going into a community through an application process. And so those communities who are interested in participating, they apply, they go through the process, and they go through they go through this year of training and formation for leadership, and also identifying what would be the best project for that rural community to receive funding for. And that project could be a playground, or it could be something related to food access. Each site differs, and it's been a fantastic program. But I mean, we also have programs related to behavioral health, quality improvement for the healthcare facilities that our technical assistance provides, and also Healthy People, Healthy Carolinas, looking at chronic disease, and also an arm of that, food access. We have a great partner that is Food Share South Carolina, and that's one of many. We're very thankful to have all these partnerships, and I couldn't speak to all of the obviously all of the offices of rural health throughout the country, but in terms of, for us, we are involved in many different conversations that are multi-sector, and in my role, I know I especially do that to make sure that rural has a voice at the table. And I know that for all of the offices of rural health, they want to make sure that rural has a voice at the table, from policy to boots on the ground.
Yeah, hugely important point. And yeah, so if any peers or folks interested in that intersection of health and housing are listening in today, do we have the way that they get in touch with you? Paula is an amazing resource, and I don't want to fill up your email box, but whenever we contact her, she can get right back to us, and is really a leading ability to think about how these things intersect. So folks, reach out to Paula if you need help in that area.
Absolutely. Our website, score.net, and you can find the different programs that we have. There's housing with rural health. There's so many avenues to look at it. And I'm sure we'll have more questions to dive into that. But as I prepared or thought about this conversation, I thought there's no way in this conversation we can talk about all the ways an individual is health is impacted through inadequate or lack of housing, and knowing that South Carolina, we have the highest number of evictions in the country. And that was before COVID-19. So imagine all of the calls with United Way 211 that have
Yeah.
as a result of.
I find myself using that and other stats with what's generally a suburban and urban crowd of folks who do housing work, talking to them about where poverty truly lives. 86% of persistent poverty counties being rural, high eviction rates, deeply divided communities in some ways. We've got a lot of the same challenges. Fantastic things as well. Obviously, all of us have some real love for the small towns and rural places that we live or we're from, right? Or we probably wouldn't be in this work. And we've seen so many vibrant and wonderful places, but the challenges are real as well. And bringing attention to them through your work and other people's work is just, it's fantastic, much appreciated. So Sarah, another question came in here. What impact has the CARES Act had on your properties? What's been your experience with USDA and HUD in implementing any of those pieces of the programs that you use?
A couple different ways, actually. CARES Act specifically, and I guess programs like that. The management company did apply for a PPP loan that is able to help. Right now, we're being very cautious with those funds, of course, making sure that salaries are covered, but then also preparing for other things. So like I said, pretty much we've been able to keep everybody at work. We have had some employees that health compromise or different things like that. We were able to have them work from home or different things like that and still keep up. So that was one way. North Carolina Housing Finance Agency did a 3-month mortgage relief on a couple of our properties, which helps. So, we'll pay it, but in future years. So that was so we were able to put some money aside to help with rent relief and different things like that if we get to that point. USDA for our self-help TA grant, they were offering extensions for delays. So we were able to apply for a 6-month there. And then pretty much all of our home repair funders were able to apply for CARES Act money, and our grants were extended as far as timelines go. So really, there's multiple different things that a lot of the different funders are going for. As an agency, we were able to keep working either at safe distances, one person in a house at a time, or work remotely. So we didn't have to do that. We wanted to leave that money for others that desperately needed it. But like I said, I really feel like the agencies and funders are coming together to make it work. I feel part of a team, not left on an island. So it's good.
That's great. Yeah, many times those of us who work in these fields grouse a bit about our relationships with the agencies and the departments in DC, but they are full of a bunch of people who are trying really hard to make sure that these dollars hit the ground and are in service to the communities that we're also trying to help. Let's see, I got a couple more questions that have come in here. So we've got someone who reports on a rural county in my neck of the woods here near DC, and their real estate analysis shows that people may be looking to move out of cities to rural areas as a result of the pandemic. Have you heard that? Do you see that happening? Do you think it will have an impact on the markets in which we work?
Yes, I would definitely. My board chair is actually a realtor, and he has just said they're getting more interest in people wanting to move to our area. We were a retiree area, but they said the Western North Carolina Realtors Association has seen more families put out feelers than ever before.
Yeah, I got a similar report from a friend, an organization out in Montana that was talking about the same kind of thing happening. Hey, Lance, there's a question here that asks what kind of data you wish you had that that you could use to impact federal policy. I don't know if that was one of your cousins.
Yeah, no, how long do you have? So do we have another couple hours? No, as I noted before, I think there has been a really good faith effort by some entities. There was an email popped up that there's going to be some more data transparency around Fannie Mae and Freddie Mac. As many of you know, they service a large number of loans related to COVID-19. It's been interesting times in the data world because sometimes we don't have access to this, as I noted, daily data where we're getting information on the virus itself. But at the same time, we could always use better data in rural communities. There are a lot of constraints and a lot of lags. I would say on the immediate concern, if we had a wish list, at the top of that would be we get some immediate indications from Fannie Mae and Freddie Mac on their forbearance requests. That's somewhere apparently hovering around 7 or 8%, and it was almost in line with Myra's number. Close. I did the quick math on 150 divided by 2,300. But I would say what we would really, I think, to help us would be, there's often been a lag in mortgage applications and just housing demand from the FFIEC and the Consumer Financial Protection Bureau, and a lot more information. I think the agencies have done a really good job of actually responding to this, but we could always use more data and just understanding that some of the constraints in rural communities and making even more concession there.
You know, Myra, you guys are building up a pipeline of potential borrowers. I mean, these are the individuals that all of us, our missions are dedicated to trying to get to. It's extraordinarily hard work. You guys are some of the best at it. Like, what are you seeing for the folks who've been trying to queue up to get a mortgage from ASHTI and or other organizations like this? Have there been impacts to that group?
Yes, initially not as much as we thought. Again, I think that's one where the biggest impact is going to come later in the year. But initially, we started off 2020 with a bang. January was our highest number in profiles and applications submitted, with over 400 applications. And that's in the history of the organization. So we thought 2020 was shaping up to be a great year. And then COVID came. And so February was still high, not as high as January. March, however, was dismal. And we thought, okay, this is it. Interest into homeownership has shifted, rightly so, justifiably so. And so what are we going to do? And so we decided quickly to start pivoting into some other areas that we might help, for example, tenant-based rental assistance, if we can participate in that, if we could participate in other things, so we could remain relevant and not go away during this time. And we did some other outreach, not related to homeownership, just so we can stay in people's minds. So March was dismal. April was surprisingly better than we thought, better than March. And May was even higher than April. So I can't crack that nut. So does, it's, I was thinking about it yesterday and thinking, I just expected a decrease all the way down in interest of homeownership. And it took a dip and it's back up. But again, I'm thinking that that's going to come later in the year, the impact. Now, for those that were already approved for the loan and the home was being constructed and they were getting ready to close, yes, we have had probably maybe 4 or 5 people that had lost their jobs or hours reduced. And so because we use our own loan product, we finance our own mortgages with our own loan product with our underwriting guidelines, we're able to be a little bit more flexible. So we've allowed some extra time for them to hopefully have those hours built, come back up. And some of them have been able to go back to work and are now able to qualify or afford the house payment. And so we've been able to close on those. One of them sadly was not able to. And so that one we had to, she had to withdraw. So again, I think the impact, I think we're going to see the numbers increase July, August, September, and late in the year. But so far, it's been little, but there has been some impact.
So we're reaching near the top of the hour. We're going to run over for a couple of minutes. Want to remind folks that a survey will go out after this. I probably have, if you have other questions, get them in the chat. We'll get back to you. Probably got time for one other with Paula about housing as healthcare. But Myra, I had a conversation with USDA has a fantastic single family housing staff. And I was on the phone with them. I think it was just last week. And they were saying they were having the best year that they'd had in a long time. And what that means is they have a limited number of low cost mortgages that they are getting to families in need. And they said they were way ahead of pace. And we were starting to pull it apart. And, silly us, it dawned on us after a minute. The resources that we have out there for affordable housing are minuscule. We sink as much into a mortgage interest deduction as we do into all affordable housing programs put together in this country. And guess what? A whole bunch of people who've been on that razor's edge of one sickness, one lost job, one, water heater exploding from really having housing challenges. And those folks are streaming into that population that we serve. So while there will be real effects on the people who are already in line as they lose their jobs and fall further through the cracks, I would expect our world's going to face a whole influx of folks who desperately need these resources and a need to build them and grow them. So Paula, I've heard you say housing is healthcare. And of course, I think that's a fantastic way to frame how there are social determinants of your health outcomes. Can you say a little bit more about how housing is situated amongst those other factors and what we can really do as housers to improve those outcomes that you and your organization or your agency look so closely at?
Well, to answer and to piggyback off of a comment that came from the chat, I really like the question about, or the comment about, what does it look like? Are people moving to rural areas in general? And we have an arm of recruitment and retention for healthcare professions, not just doctors or physicians, but everyone related to healthcare, including community health workers. And in addition to that, we're looking at retention and recruitment for the people who live in rural areas and making sure that and I mentioned this before, how we celebrate rural areas and the culture and the resources that they have right now. And we definitely want to make more resources available and also highlight those areas that have already something and build upon it. So when we look at housing as healthcare, when we're thinking about COVID, let me think about yourself at your house and not being able to go to the store or go out and do the normal thing. You are confined, let's say you're confined to your home. Now, if we're looking at disconnected, defragmented systems in a rural area, there's a lot to be desired for transportation, for broadband. And if we just take out one thing of housing and broadband, then a household will automatically, their health will be deteriorated because perhaps they're going to be afraid of going to the hospital because they don't want to get exposed. They're thinking they'll get exposed to COVID-19. That could be a thought. Or they don't have the proper equipment. They don't have the broadband to have an assessment with their healthcare provider, and so their healthcare could deteriorate. And then also with the children, with their schooling, that is also something that sets them back. If we think about joblessness, I mean, everything is exacerbated. So, I mean, when I first started in this role, I started with, or I believe our CEO mentioned a conversation, or he said it himself, without a job, someone can't be healthy, or it was something that, one of the first things that really caught my attention was like, it's true. I don't have a job. How can I have a car? How can I buy a house? How can I do these things? How can I provide for my children? So that was one of the first things. And then of course, with inadequate housing, if you don't have food within the house, if you don't have the broadband within the house, if you don't have clean water within the house, and that is still an issue. With the environmental justice programming out of DHEC here in South Carolina, there's so many things and funding opportunities for the schools, for homes, people who still have water that is unfit to drink. And these issues are caught at schools because a child is not feeling well, or their school performance. Like I said earlier, it's impossible to really hit the nail on the head with housing as healthcare, because there's so many things. If someone is asthmatic, if someone doesn't have these different avenues for access, then chances are very slim. And I wish if you could ask me something more specific about housing as healthcare, I think I would be much more useful. But there's so many things, and I think that's a good thing. It's good because it's an opportunity for more people to get together, and that's where the value is. And I actually received an email from someone in the YouTube audience saying, "Hey, I had this conversation last week. I would love to hear your feedback." And so that's what we need. We need the feedback from at a national level, hearing what's going on, so that we can alleviate and educate people multi-sector to allow them to see how they can help in housing and how they really are a part of it, whether it's mental health or employment. The unlikely partners are what we need to have together in order to really open up and see how housing is healthcare in rural areas.
Yeah, well said, Paula. And that's a great one. I think we'll wrap it up following that. I love the fact that you guys joined in today. It's an honor to work with the four of you, and as we keep up our work, Myra, Paula, Sarah, Lance, thank you guys. Thank you, Rural Strategies and the Rural Assembly for being able to put this thing on. We're back here next week, Tuesday at 2 p.m. Got a couple of great guests, and we're going to talk about the federal response to the pandemic and the challenges it's presented to housing. To anybody out there, get in touch with us. Follow these folks on Twitter. And hit us a note if we can be of any help to you or your organization. Thanks, everybody. Really appreciate your time today.
Thank you. Take care.
Bye, everyone. Take care.
Bye.